Good evening, everybody, and thank you for joining us tonight. Before we get started, I want to share a few brief housekeeping announcements. First, we would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your COVID-19 pediatric vaccine questions over the next hour with our panelists. And if you do have additional questions or need clarification, we ask that you please use the Q&A function in Zoom. And as a reminder, this is a public forum, so anything you type will be visible to others. Tonight's town hall is being recorded and streamed live on Facebook, so please feel free to share that link so that others can tune in, and we will paste the Facebook Live link into the chat momentarily. And finally, a recording of tonight's event will be available on the Montgomery County YouTube page, and we will also send that link out to everyone who registered tonight in case you might have to jump off early. And now it's my pleasure to turn it over to our moderator to start tonight's town hall, Dr. Lorraine.
Thank you very much, Kelly, and thank you all for joining us tonight. This is the fourth of 4 town halls for pediatric COVID vaccine questions for parents. And these town halls are sponsored by the Montgomery County Immunization Coalition and Montgomery County. And along with them, we have multiple community partners and faith-based organizations that have also sponsored these town halls. My name is Dr. Richard Lorraine. I'm the medical director of the Montgomery County Office of Public Health, and I will be moderating this night's session. I'll be joined by 3 physician leaders from the local medical organizations, and they'll be introducing themselves a little bit later on. Dr. Angela Nicholas is with us, Dr. Stephen Shapiro, and Dr. Tara Berman. And I do want to give a special thank you to Beth Till of the Montgomery County Immunization Coalition for the tireless work that she has been putting in, not only in setting up these town halls, but overall for all of our efforts in COVID-19 immunization and other immunizations as well prior to this pandemic. It's very, very important that we have forums like this so that we are able to get this information out to the public in a way that's understandable and digestible. There is so much information coming out these days. It's very, very hard to make sense of it. And you also need to be able to get it from trusted partners. Now, although I certainly take credit for us tonight in this forum being hopefully a trusted partner for you, I will tell you that my bias is that the most important source of information that you can get about your child's immunizations is from your child's pediatrician or family physician. These doctors and advanced practice providers have been following the science from the beginning. They understand the information, and they are the ones who you can trust the most to give you specific information for the welfare of your child. So the format for this evening, we're going to do some brief introductions, and then we're going to start going through the questions that have been previously submitted. And we'll go around to each of our participants and allow them to answer those questions. That will take probably about 40 minutes or so. At that point, we will then be open to answer questions that have come in this evening through the question and answer function. So if you have questions that are not being addressed, please, we encourage you to enter them into the Q&A, and we will get to them as best we can towards the end of the evening. Now, that being said, I'll just finish my introduction very briefly. I mentioned that I'm the medical director of the Montgomery County Office of Public Health. Been doing that for about 4 to 5 years, but I'm also a practicing internist in Montgomery County. I've been doing that for 35 years. And in addition to that, I'm commissioned in the Pennsylvania Air National Guard, and I actually command an emergency response medical detachment. We will then move on to our other participants. And Dr. Nicholas, will you introduce yourself, please?
Sure. Thank you so much for inviting me. I'm Dr. Angela Nicholas. I am the Chief Medical Officer at Einstein Medical Center, Montgomery. I'm also a practicing family physician at Northwest Family Medicine and the interim program director for the Einstein Montgomery Family Medicine residency program that has an office in Norristown at the Carabots building.
Thank you very much, Dr. Nicholas. Dr. Shapiro.
Stephen Shapiro, I'm chairman of pediatrics at Abington Jefferson Hospital, or Jefferson Abington Hospital. I think the name changed again. And I'm in practice at Pediatric Medical Associates in East Norriton, Pennsylvania.
Thank you. And Dr. Berman.
Hi, thanks for having us and hosting this. I'm Tara Berman. I'm a general pediatrician in the Nemours Children's Health System in the Philadelphia primary care location, and I've been here for 17 years.
Thank you, Dr. Berman. And as you can see, we have a real wealth of experience on this panel tonight. So I'm sure we'll be able to get a lot of great information out. Now, having said that, we're going to start with the questions that have been submitted previously. And our first question is for Dr. Shapiro. So some parents are concerned about the safety of the vaccine. Can you please explain the steps that have been taken to ensure that this vaccine is safe for children?
That is a great opening question. Ladies and gentlemen, we've all been exposed to really the miracle of medicine in the process of seeing this vaccine come alive and vaccinate 195 million people already, and have such a profound effect on our world. But I want to reassure you that as a science, there were no steps that were omitted. Now, by example, if you take a drug and you want to test it according to the standards of care that are used today by the FDA, the process might take 10, 11, 12 years. And the reason there's been such a profound difference is that every phase of the testing is done in line. The patients are tested and followed, and all of their results are in before the next phase is tried. So there are 3 phases of primary research done by any reputable, in this case, Pfizer or Moderna, any reputable company that is well known to make vaccines. They would normally do this in phase 1, phase 2, phase 3, and then it would be available to the public. What happened with COVID, with the urgency for the COVID-19 vaccine, was a very simple thing. These brilliant scientists just did all phases side by side. So phase 1 was running when phase 2 was running, and phase 2 was running when phase 3 was running. And all of the data flowed from one phase to another. So that gave the scientists and the people that were recording the data all of the information almost simultaneously with the completion of each phase. And that was just remarkable. That was science at its best. And to that end, that vaccine was available available under an emergency use authorization within about 9 months. So that's what happened, and no steps were skipped. Let me reassure the listeners, no steps were skipped. This is the same as if any of the normal vaccines that we use in childhood were utilized and were studied. They were just studied simultaneously and in consecutive order. So it really was a very well done scientific effort.
Thank you, Dr. Shapiro. Dr. Nicholas, can you discuss the side effects of the vaccine on 5 to 11-year-old children that were found in the clinical trials?
So the good news is that there was nothing surprising. The same types of side effects that adults have, children had. So in the arm, pain at the site of injection, occasionally some redness or swelling at the site of injection, very similar to some of the other childhood vaccines that children get. And then the other side effects could potentially be tiredness. Some headaches or muscle pains were reported, along with chills, fever, and occasional nausea. There was not an extraordinary number of side effects. And again, very similar to what adults had when they received the vaccine, and similar to the other pediatric vaccines that we give children, including that's very similar to the side effects of the flu vaccine.
Thank you. Dr. Berman, some people have asked about the effects of fertility in premenstrual girls. As a matter of fact, this is a question that's come up since the beginning of the use of the vaccines for adults. Is there any concern that we should be worried about with this?
It's a good question. It's an understandable concern. You know, we don't have long-term studies on the vaccine in kids. I mean, adults have been getting it for a longer frame of time, and we have no reason to believe there is any effect on fertility. No other vaccine, and we are not new to vaccine development. No other vaccine has caused any impact in fertility. You know, the ingredients of the vaccine are excreted very quickly from the body's, you know, our normal process of metabolism. So, you know, the ingredients of the vaccine are not maintained in the body. And the vaccine just, you know, our immune system does the work it has to do and should not affect any reproductive system. And there's plenty of women who have had the vaccine who are pregnant. So it is not, there's been no evidence to show that it's affecting women of childbearing age to get pregnant.
Yeah, and I'm just going to amplify that answer a little bit too. You referenced that we have not seen thus far in women who, adult women who have gotten the vaccine, any difference in fertility. There was absolutely no difference in the clinical trials. And in the post-marketing data that's been submitted to the CDC, there is zero difference in terms of fertility rates. So there is nothing that has been seen with that at all. Thank you, Dr. Berman. Dr. Shapiro, how do we know that this new science of mRNA technology is safe in the long term for these very young children who are still developing?
Another excellent question, ladies and gentlemen. I thought a lot about this question because the clear answer is that the messenger RNA technology is well known to us. We've been working in the areas of science with messenger RNA for many, many years. We knew that messenger RNA could be a good messenger, as its name suggests, into the human cells to help create various situations that would improve the quality of life. We also know that with messenger RNA, unless there are products specifically in the preparation that can turn RNA into DNA, which none of these vaccines have, there really is nothing else for the messenger RNA to do except deliver this particular sample of a protein that is part of COVID-19 into the cells and let the cells then do their normal work. There's nothing that changes the normal work of any cell in a small child's body or an adult's body. And in the case of children, I feel very comfortable telling you that the children themselves and their immune systems are so ready to respond appropriately to the vaccine that they're being challenged by. I have no doubt that their immune systems will in many ways show, and as the 5 to 11s get a little further out, demonstrate that the responses are very brisk and safe and will continue to be safe, perhaps even a little longer than what we've been seeing with the adult population. But as far as the young developing children, ladies and gentlemen, this doesn't get into the nuclear material of any of these cells. It never will, it can't. It doesn't have the products, the chemical products, reverse transcriptase and integrase, any of those products that can get it into the DNA or the nucleus of any of our cells. It's just going to bring that message into the immune system that says, and there's so many different platforms for this to happen on, but in this particular one, it is just so remarkable to see how robust and how incredibly sophisticated the response has been.
Thank you, Dr. Shapiro. I will add one comment to that. The way the question was phrased, the new science of mRNA technology. So people should be aware that messenger RNA technology for vaccine has actually been in development for well over a decade. Right. This has been going on for a long time, and it basically took the pandemic to accelerate the use of the messenger RNA technology, but it's not new, and this has been worked on for quite some time.
That's a good point. That's a good point.
Thank you. Dr. Nicholas, why are we encouraging the least at-risk population, young children, to get vaccinated?
Well, we're all acknowledging that children are really at a lower risk for becoming severely ill with COVID. But the children can get infected. They can get very sick from COVID. They can have some short-term and long-term health complications like adults do. And they also, and probably most importantly, spread COVID-19 to others. So children that are that have underlying medical conditions that are also more at risk for severe illness when you compare them to children who get COVID without any underlying medical conditions. Children who get infected also can get a serious complication that we call multi-system inflammatory syndrome, where different body parts become inflamed, like the heart and the kidneys and the brain, or the gastrointestinal organs. So it is important that we think about this population in large groups, and a small subset could potentially get very seriously ill, and we want to prevent that for everybody. In addition, vaccinating children will help prevent adults from getting the infection. And we all know that there's a subset of the population that cannot get vaccinated because of a medical condition that they potentially have. So if you vaccinate the kids, you're hopefully preventing illness in maybe another family member who can't get vaccinated. It can help children, prevent children from getting seriously ill if they get COVID. Can also keep them in their regular activities. So children that get COVID still need to be quarantined like everybody else. We saw some of the side effects of keeping children at home for long periods of time when we were in, when we were in this lockdown and schools were closed or schools were open, and some days they were open and some days they weren't. It was very confusing and complicated for kids. So keeping them in their regular activities, their play dates, their sports, their group activities is still really important for the mental health of our children. And most importantly, it helps to increase that herd immunity that we keep talking about. We're really angling for a large percentage of the population to get immunized to protect those that can't be immunized. And so vaccinating our young children will most effectively do that.
Thank you. And sad to say, I'll also point out that our data suggests that the incidence of COVID infections in the younger population is on the rise. We are definitely seeing some increased numbers recently. There's also a question, this gets a little bit arcane, but there's a question about whether the initial low rates of infection for children were a little bit artificially decreased because it was at the time when schools were closed and they weren't really coming in contact with each other. So there is significant reason, as Dr. Nicholas mentioned, for children to be immunized. Dr. Berman, can you speak to the potential risk of myocarditis, heart inflammation, as it relates to getting the vaccine?
Sure. So, I think this is a product of a lot of misinformation that is influencing people's decisions. So myocarditis, the incidence of myocarditis as a post-vaccine complication is very low compared to getting myocarditis from the natural infection itself. So there are way many more cases of myocarditis and other heart complications from getting the infection, the natural infection, unfortunately. The vaccine, there were a small number of cases that understandably deserve some attention and looking into. The cases that have occurred have been very mild, have been treatable, and no child has succumbed or died from heart complications from COVID, isolated myocarditis. As Dr. Nicholas mentioned, there is a multi-system inflammatory syndrome that can involve the heart and is a more serious complication from the virus, not from the vaccine, The cases that have been reported have been more common in males and more common after the second dose, and very shortly after the vaccine was given, so within 7 days. And that, you know, the symptoms to be concerned about would be shortness of breath, chest pain, heart palpitations. So if anyone is experiencing that, they should be seen and evaluated. But the diagnosis associated with the vaccine itself is very mild, and the patients have fully recovered from that diagnosis. The benefits far outweigh the risk for getting the vaccine.
I was just going to add that, Tara, that we know what the myocarditis, if any, that occurs from the vaccine, we know what that's going to look like, and it will get better. What we do not know is what the myocarditis from COVID, from the virus, will look like now as well as down the road in the next years. That's
much more serious condition.
And I also want to add, there was a question about did the myocarditis happen in the clinical trials? And I actually just looked it up quickly. There were no incidents of myocarditis in the clinical trials for the COVID vaccine.
It was after distribution that the cases were recognized.
Right. And that's perfectly understandable, because as with every drug and every vaccine that goes through the approval process, there's only a certain amount of people who are in those phase 3 trials. When it's released and in general public use, now we're talking not just thousands, but tens of thousands and hundreds of thousands of people. So these very, very low risk side effects and complications may show up just because of sheer numbers. The important point there is that it's still a very, very low incidence. Thank you. And Dr. Shapiro, can you pull out your magic 8-ball, please, and tell us, when will the vaccine be fully approved by the FDA?
Well, thank you for giving me this question, Rich, because it sort of follows with the first question about the steps that it's taken to bring this vaccine to the public. I think that we've seen from the way FDA works, now that side-by-side phase 1, phase 2, phase 3 trial that I was discussing with you earlier has been completed and the vaccine has been given to 195 million people, the approval phase is going to run at a different pace. We've already seen the Pfizer vaccine be approved for commercial use. That means that any of the doctors in this panel can take that out of their refrigerators or whatever and use it as per their need would be, and the vaccine is readily available. The issue of when the FDA will approve the Moderna product and the J&J product that's still yet to come is really anyone's guess. Moderna, I think, has just recently submitted their information to be considered by the FDA. But I think, ladies and gentlemen, you're going to see a much longer process in this whole evolution that we're living through to the approval of the Moderna and then the J&J for commercial use. I think it'll come. I have no doubt it will come. These are wonderful products, and it in no way impugns the validity of the work or the success of the vaccine in any way, shape, or form. You just don't need to worry about that. But realistically, I don't think anybody really has a good feeling as to when it will be fully approved. I think, and Dr. Berman and Dr. Nicholas can comment as well, I think it's pretty safe to say that the children, the 6-month to 4-year-old approval will probably come after a little bit more in-depth review of the data and the seroconversion rates, and probably be available to us for those of you who have children younger than 5, probably by spring, late winter, early spring of next year. And then we'll begin to start using it at that time on that population. I don't know if anybody else has any more information than that, but.
Yeah, that's my understanding as well from our infectious disease specialist at Nemours. That has kind of been the projected time frame for the Pfizer vaccine to come out for the younger ones. Early 2022.
Right. Richard.
Sorry, I was muted. Yeah, it happens. I've been asked many times about why these are emergency use authorizations and why there is not a regular approval on these vaccines. And I point out that the fact that there isn't a regular approval indicates the need for the emergency use authorization. As Dr. Shapiro was talking about, the regular approval process is a very, very defined process with many, many consecutive steps taking a lot of time. And I can tell you, as a clinical investigator in many trials, there is no end of paperwork and forms and reviews that is done for this. So it takes a very long period of time. If we were to get these out in time to be able to really make a difference in shifting from pandemic to endemic COVID, we really needed to utilize this emergency use authorization process. And again, as Dr. Shapiro said, it in no way impugns the value of these products. It just shows that there is that need for the emergency use authorization because of how long the regular approval process simply takes. All right, thank you for that. Dr. Nicholas, do you think children 5 to 11 will need boosters in 6 months or become eligible just as adults have?
Well, I think we're back into the crystal ball questions. I think we're going to probably rely on some science for that. So as Dr. Shapiro talked about, we're doing phase 1, phase 2, phase 3 at the same time. That does allow for the manufacturers to collect data and collect data on the antibody and how strong the antibody is that your body has created as a result of getting the vaccine. So I think what we're going to hear about is the data, and that's how the booster vaccine came along, because the companies presented the data, and then the data then drove the decision to allow for the booster vaccine. So I think we're going to wait for the data. My guess is, I don't know if I have a guess. My sense is probably because adults, we had it for adults, and my guess is it's probably going to follow the same thing, but I don't have that answer. And again, I'll wait for the data and look forward to hearing what the data shows for this.
Okay, thank you. Dr. Berman, where can parents get the vaccine for their children?
It's pretty widely available now. The distribution lines were well established for the vaccines that have already come out. So the local pediatrician. So call your pediatrician and see if your pediatrician's office is offering it. They might be on a scheduled basis, or there's different practices are scheduling clinics on certain days to accommodate as many people and to use the vaccine without wasting a lot of vaccine, because there's multiple doses in a vial. So we try and get groups of kids at the same time to vaccinate. And the pharmacies, so CVS, Rite Aid, there are pretty much all of them are offering the vaccine for 12 and up. There are a few, maybe a few locations specified for offering the vaccine to kids between 5 and 11. And again, it's because of the supply of the vaccine. But you can definitely check your local pharmacy, check the websites. The county is offering, Montgomery County has 4 different vaccination sites, and through their website, you can schedule an appointment to get vaccinated. And the schools, I think the schools are increasing their ability and partnering with other pharmacies to provide vaccine clinics at schools, or the school can help advertise where they're offering their students to get vaccinated. So it's pretty widely available. It's relatively easy to get. So search the websites for that.
Can I just add one point to your point, Darren? You made a very good point. The schools have been very much a part of it. I had volunteered to be part of an immunization project for a school tomorrow, and we had blocked out a 3-hour block. And I got an email from the nurse coordinating it that they've contracted this 3 hours to a half hour because all these other kids have already gotten their shots. The 5 to 11-year-olds have gotten their shots in various other places. So what Tara said is spot on. You just want to know it's out there. We know how to give it. I think that the pharmacies have become good partners I don't know how you feel about that, Tara. I had some
Yes.
some concerns at the beginning, giving little kids vaccine in the pharmacies, but I feel confident about that now as a pediatrician. And I tell parents, if you can't get to us, to our office for the shot, go to the nearest place, but get the vaccine.
I would also add, like, say, you'll get a vaccine card that documents the date and the lot number of your vaccine. And you definitely want to keep record of that and share that with your pediatrician so we can go onto your child's full vaccine record, because it doesn't always completely integrate from the other sites. And your pediatrician has the full vaccine record for your child. So it's important to have the COVID vaccine added onto that.
Quite true. Absolutely.
And I would not hesitate to take pictures of the vaccine card. Actually, you want to show that card in person, because there's been a lot of falsification, unfortunately, of the vaccine cards too.
And just to emphasize, I'm going to circle all the way back to the first thing that Dr. Berman said, which is talk to your child's doctor. That's always the place to start.
Mm-hmm.
Okay, Dr. Shapiro, got an easy one for you.
Yeah.
Is it safe for children to get the flu shot at the same time as the COVID vaccine?
I can make it very clear. Absolutely. But I will say, just a little history. Back in January, when we all were given this vaccine, we had some basic marching orders that said, give the COVID vaccine separately from any other vaccines that you were giving at the time. We didn't know better, but then, the beauty of, for all of you who are not in the field of science and are listening tonight, is you saw science working in front of your eyes. You watched how decisions were made. They weren't always the same decisions. You knew there was, you listened and you heard CDC saying something different than FDA, et cetera, et cetera. But at the end of the day, we learned from every one of our decisions and every one of our observations. And I remember reading with joy, because it really put a hardship, because as a pediatrician, I give a lot of immunizations. It was very difficult to want to get the moms the COVID shots and, give the other ones around so it didn't bother the moms. And the older kids, when they came, we had to give their vaccines. And then to find out that it really doesn't matter was a beautiful thing. So that was a long answer to that first word that I said. Yes, get your flu shot. As a matter of fact, I was in our office, and one of the kiddies came in, got the COVID in one arm and the flu shot in the other arm. My nurse and I did it at the same time. So she got a double whammy.
I think that's pretty impressive that you did it at the same time.
She was pretty brave, I got to tell you. I don't think that happened too many times.
Agreed. Thank you. Dr. Nicholas, with a larger number of children potentially being vaccinated, do you expect mask mandates will be lifted in schools? And actually, there's been a bit in the news about this recently.
Yeah, there has been. Again, this is another crystal ball question. I think as the number of children get immunized, I think that's probably going to happen. We saw as the number of adults got immunized, the mask mandates are somewhat lifted. Although if you go into large populations of people, large crowds, we still recommend masking if you're not clear about the people that are around you. So I do think that there's going to be a big push for the lifting of the mask mandate. Probably my guess would be springtime again, and that's a total guess. I really have no idea, but I know that a lot of parents are excited about that because they are getting their children vaccinated. I still think that those that are not vaccinated will need to wear their mask to protect themselves.
Can I add, I just learned another fact that I wanted to share with you. And really it is, if you watch Europe, the incidence in Europe is often a little bit of a harbinger for what we're going to see. And Europe, despite pretty high vaccination rates, is seeing the uptick in the number of cases of COVID now, because temperature changes, the seasonality, and the mobility of people in Europe is much more extensive than even what we've been seeing. It's almost back to the same state as the pre-pandemic. But what they've looked at, what they've been able to say is that mask wearing for whatever it's worth, mask wearing has decreased by about 20%. The populations that are wearing masks is decrease. You see a decrease of about 20% in the incidence of an infection. So if you watch now that we're in the flu season, watch Europe for their flu results in the newspapers and in the press and wherever you get your news from, you might see just a little bit better, get a better idea as to what the mask mandate really will look like for us and what we need to do. It's a difficult question. I mean, we in healthcare are still wearing masks in all of our day-to-day operations in our offices and in our hospitals. I mean, that's a fact. So you have to kind of take these decisions on your own. And, you know, if you're in your own pod, maybe feel comfortable taking the masks off. But generally speaking, watch what's going on in Europe.
So I'm going to add to this. Right now. Oh, go ahead.
And kids, you know, it's become kind of a normal accepted thing now for everyone to wear masks. But kids, you know, they get dressed in the morning and they put a mask on. Like they don't.
I agree. The kids are great. The kids
yeah,
are just
it's a really, I mean, it's a low risk. It's a high benefit, high yield benefit from really a minimal intervention, a simple intervention.
Absolutely.
So having had to answer that question a little bit earlier today, I'm going to try to clarify the current situation in Pennsylvania regarding the governor's mandate for masking in school. By the way, is anybody hearing that echo that I'm hearing right now? Okay, yeah. I'll try to repeat it. So the Governor Wolf had a...
Could just mute if you're not speaking. Thank you.
Yeah, that's better for me. Governor Wolf had issued a mandate. Actually, it was the acting Secretary of Health, Allison Beam, who had issued a masking mandate for school. And they had recently announced that they were going to withdraw that mandate as of January 17th. Now, in the meantime, there actually was a court case that was brought regarding this as to whether they had the authority. The acting Secretary of Health had the authority to issue that mandate. And as of last week, the ruling came down that she did not have that authority and that the masking mandate needed to be ended. It was appealed by the Wolf administration and there was a temporary stay on that order. I believe it was either today or yesterday. I didn't quite catch it, but there was an additional ruling from the court that said the mandate must be released by December 4th and that the stay was lifted. So what that means for right now is that the governor's mandate for masking in schools legally has been lifted. That allows the individual school districts to make their decision as to what they recommend. We in Montgomery County do provide them with information, and we are able to give them information in terms of the infectivity rates within their school district, which hopefully allows them to make an educated decision as to whether to continue to recommend masking. There are also some programs, testing to stay and testing to participate, which actually do require masking to go along with that, but that's a subject for another time. So right now, the mandate is a little bit confusing, but the individual school districts still have the ability to recommend masking within their schools. And we have one final question, and I'm going to actually open it to the entire panel and we'll take it in turn. We're going to look at this one question. What would you say to parents who are hesitant to get their 5 to 11-year-old child vaccinated? And let's start with Dr. Nicholas.
So I have this conversation pretty much every day at this point. And I think that most parents believe in the science of vaccines. They have their children get flu shots. When H1N1 was a thing a couple of years ago, parents really fought very hard to get their children vaccinated. I think this is the same thing. I don't think there's any difference in COVID versus H1N1. Obviously not in illness. It's totally different virus. But we're talking about the same kind of issue. if you get your children the flu shot, you should for sure get your child the COVID vaccine. In addition, I'd say the majority of our communities vaccinate their children as well for other childhood illnesses, measles, mumps, varicella, all of the other childhood illnesses. And we do that because we want to protect our children from getting very seriously ill. And in fact, we also do that because we are trying to protect those that can't protect themselves because of their medical conditions that can't get vaccinated. And lastly, I'll just point out that, we've probably made at least national news with this viral of smallpox that got found in the Merck refrigerator in Gwinnett earlier today. And I was asked again about that. And miraculously, we don't have smallpox in the world anymore because of the vaccine. There has been no more cases of smallpox since 1977. So, vaccines work. We know they work. I don't think this is any different than anything else that we vaccinate our children for. And so I think we're doing the right thing. So please vaccinate your kids.
Thank you very much. Dr. Shapiro, same question.
Just needed to unmute. Yeah, this is, I thought this was probably the most important question we answered all night, Rich. Obviously, what Dr. Nicholas says, I fully endorse. The vaccine is safe. The vaccine gives us protection against a virus that we don't know about the long-term sequelae, the long-term complications for. We do know what the vaccine does, but I take a little bit different view. I talk about the 5 to 11-year-olds as spreaders. As we all know, they're the kids that carry it to the rest of the population, the family. And I talk about the fact that for 18 months, the kids were really not in school in a good situation. Those things resonate with me, ladies and gentlemen, because as a pediatrician, seeing these children now back in schools, as good as our teachers were, and as rapidly as they pivoted, there were such gaps in what these children needed to learn. It's important for all of us to understand we're not just giving a vaccine, we're giving you an opportunity by giving this vaccine to your children, to get back to some semblance of normal. And normal, I don't know what normal is right now because we're sort of coming out of this pandemic, but I know that the normal that I'm seeing out there now is a lot better than the normal I saw back in March of 2020, when we couldn't bring kids in to be checked and kids got sicker and adults put off surgeries that they needed and diseases were not diagnosed as well. But if we want to get back to normal, this is the path. Maybe you think it's the path least taken, some of you, but please understand that 1 million children have already been vaccinated with the 5 to 11-year-old vaccine. And I urge you to take that along with where your family has been and where you want to be with your families going towards the holidays, obviously, and know that if you protect the children and you protect yourselves, hopefully, then you begin to be looking back at a much more normal and a much more congenial and together friendly, more enjoyable existence. I'll leave it at that.
Thank you, Dr. Shapiro. And Dr. Berman, any other thoughts?
Yeah, I mean, I agree with all those thoughts. We have an amazing track record with vaccines. They work very, very well, and they are very, very safe. And this is not new territory. It's a new virus, but this is not a new solution. And the consequences to kids and families, the collateral damage that kids and families have gone through as a result of this pandemic is tremendous, right? Kids aren't getting very sick with this virus, but the impact on mental health conditions for kids, the impact of obesity, the financial impact, the social impact for children and families, we're not going to recover from some of those things, okay? And it's it's a tremendous impact to kids in so many ways other than the virus itself. And the vaccine, the beauty of vaccination is that it protects the individual, and it protects who they love, and it protects everyone around them. And the more people that get vaccinated, the better it works, and the better off we all are in every way. So there's really no reason to not get it.
Thank you, Dr. Berman. And I heartily agree with my colleagues. There are so many reasons why we should go ahead and take advantage of this. I would even call it a modern miracle. The fact that we were able to develop these vaccines so quickly and they're so effective, it's really unprecedented. And it's really what's going to get us out of the pandemic. So again, I endorse the comments of all of my colleagues. And with that, we come to the end of our prepared questions. We do have a few questions that have been typed into the Q&A. So I'm going to read out the question, and then I'll just ask whoever would like to jump in to answer that to go right ahead. The first question is, what are the most up-to-date percentages of hospitalizations for children due to COVID? Does anyone have those figures on hand?
I just happen to have those figures.
Amazing.
I don't know how I had so lucky. At the beginning, this is for children. Hospitalizations for children, other than those children with underlying conditions, was very low. There was still a percentage of children that had no underlying conditions and were admitted to the hospital. But that number back at the beginning of this pandemic was about 0.8% of the total population. Now, a little further along, and children being out and about, and more of the Delta variant in the communities to be able to challenge us, and knowing that Delta is considerably more contagious, the hospital rate is up to about 2.6% of the total population of people being hospitalized, are children. That's about it. I mean, the variants are still a problem. The good news is that the Delta variant with the vaccine has a much shorter transmission time. So that should improve hospitalizations as we go forward. So it just makes it all more relevant than even from what we previously knew, to see that the populations hopefully will begin to need less and less hospitalization as more and more vaccine gets out there.
Thank you. I'm very glad you had that information on hand.
I just happened to have that. I read a little bit in the last couple of days, you know.
Great. The next question, how does the mRNA vaccine deliver the COVID proteins to the cells differently than the standard / traditional vaccine like Johnson & Johnson's? And actually, if you don't mind, I'm going to answer this one, because this is something that I have dealt with quite a bit in my capacity. So the protein actually is not delivered to the cells in either of these vaccines. The messenger RNA, I liken that to basically a blueprint. So the blueprint, the messenger RNA gets sent into the cell. It travels to the ribosome, which is like the factory. And from this blueprint of the mRNA, a protein is constructed that's the spike protein on the coronavirus, and then the immune response occurs. With the Johnson & Johnson vaccine, the protein is not part of this vaccine either, but what is sent into the cell through an inactivated virus intermediary, it's not a blueprint like the messenger RNA, but it's actually a model. So they send the model into the cell. The cell looks at the model, then creates the blueprint, which is messenger RNA within the cell, and then creates the protein. So there are some vaccines that are more traditional and just purify the protein. There's a company called Novavax that's working on a vaccine, possibly be available in January, where they actually are producing the spike protein in a plant cell, and that will be injected. But both of these types of vaccines, the two messenger RNA and the Johnson & Johnson, neither of them actually have the protein in it. They have models or blueprints so that the cell can manufacture the protein. So that's the answer for that one. Next one, is there any difference between the vaccine given to adults 12 and up and the 5 to 11-year-olds?
I can answer this question. There is a difference really in the dose that we're giving to the younger children. It's about a third the dose of what we're giving to the 12 and up and adults. And you know, if you remember on the news, they made a big deal about the different colored vials so that the doctor's offices, pharmacies, health clinics, et cetera, would remember that there is a different dose for the children. Again, all based on science, all based on the immune responses that the scientists were able to measure during the clinical trials.
Can I add to that also, Dr. Nicholas? There's a lot of concern amongst parents if you have an 11-year-old that's going to be 12 coming up pretty close, what do you do? Well, the data suggests that you give the dose according to the child's age. So if they were 11 on November 17th, they're going to be 12 by December 13th, 3rd or 4th, when the third week comes, you should give the 12-year-old dose. If by chance you don't have the older kid 12 and above dose available, it's not wrong to give the 5 to 11-year-old dose, but parents, just be aware that that's something in either case that we can deal with. I guess the message I would leave is don't wait. You know, if your kid's a month from now going to have a birthday, give the vaccine now and we'll deal with it if it works into their birth dates close enough. Just give the vaccine.
Okay, thank you. Next question. Can children still catch and spread COVID easily after receiving the vaccine? And someone is mentioning that they also have a 2-year-old who, of course, right now cannot be vaccinated. And should they be concerned if that's the only one in the family who's unvaccinated?
I can answer that. It's still possible to catch COVID if you've been vaccinated, but you're much less likely to, you'll have milder symptoms. So it's less likely, you're less likely to spread the virus if you're less symptomatic, meaning you don't have as much coughing, you're less likely to spread the germs because your symptoms are so minimal. And there are many kids out there who are completely asymptomatic with COVID. So, I mean, having the vaccine will definitely help prevent symptoms and help prevent decreased transmission. So it's completely understandable that our youngest patients, the youngest kids, less than 5 years old, who are the only population left that aren't eligible to get a vaccine, the more people that are vaccinated around them protects the youngest children.
Okay, thank you. And I think we'll take one more question. There are a couple others that are in the Q&A, but they've actually already been addressed. So for the final question, my daughter had COVID and was asymptomatic in September, and my son had mild symptoms. Should I get them vaccinated? The daughter has some underlying illnesses as well. She is 11.
I think we could do a cheer together, all four of us, and just say a hearty yes.
Yeah.
No questions.
Exactly.
Yeah, you immunize your children. Yep. There is some Mrna data that suggests that having had a COVID virus infection and then receiving the vaccine gives you a 4 or 5 or 6 times higher response to the vaccine. So in no way should you not give the vaccine on the premise that because you had COVID, you're safe. And also, just as an aside, the natural viral immunity wanes, disappears a lot faster, even more rapid than the timing we're trying to create for booster doses. So that having had COVID means that you're not protected for very long after the natural infection.
I'll also add that there's really no need for a waiting period to get the vaccine after you've had the infection. So that was not so clear early on, but now if you've had the infection and your symptoms have cleared and it's been 10 days since you tested positive, you should get the vaccine. Don't wait a few months out to get it, because you can catch the virus in the meantime. So once you get over your infection, like I said, 7 to 10 days after you tested positive, you can get the vaccine.
This question does come up a lot also in reference to adults who have gotten COVID. They question, if they have natural immunity, is that sufficient? The way to think about this is to understand that there are other coronaviruses that are out in circulation. And most of the time, what they do is cause colds. So think about this. If you catch a coronavirus and you have a cold, is it possible for you to get another cold later? Well, the answer obviously is yes. So having had an illness with a coronavirus does not necessarily give you significant or long-lasting immunity. Now, granted, this is something that we have to study, we have to really learn more about. But that does help you to understand why, after having had COVID, it's still beneficial to go ahead and get vaccinated.
I think we're going to have to learn to live with COVID, ladies and gentlemen, forever. I don't think COVID's ever going to go away. But what we have to learn to do is to protect ourselves from what we know. The more that this vaccine is utilized and the more we see these cases longitudinally, the more we'll know. And the mysteries will go away. And I predict, I'm simply one guy who's given a lot of shots out in my life for kids, will say that it'll probably fold into the normal vaccine log of vaccines that are required, even to think about entering school. Every parent has to sign off on 13 their antigens or vaccines that you must give to your children in order for them to be enrolled in any one of the 67 counties in Pennsylvania, period. You can't get in without it. And I think it's my opinion that COVID will roll into that, and children will be vaccinated regularly with COVID for the immediate and distant future.
Well, Dr. Shapiro has anticipated my final question for our panelists, and that is, what final thought would you like to leave our participants with? So I appreciate that.
That was mine. Thank you.
Dr. Berman, final thoughts.
I just see one more question in the chat here. I can quickly answer it. And I think we already answered it about the waiting to give your kid the higher dose if they're about to turn 12. And I would say, don't wait. Kids' immune systems are incredibly good at what they do. And don't wait. You run the risk of catching the infection and being on quarantine for the next 2 weeks for your child's birthday. So just get it. Final thoughts. Thank you for the opportunity. Thank you for giving us a platform to share this information and to help encourage people that vaccination is safe and important, and the strongest tool we have to be back into as normal and healthy and well as we can all be. So thank you.
Thank you, Dr. Berman. And Dr. Nicholas, close us out.
Okay, well, I think we've all said it. We're really excited that we have the opportunity to offer the vaccine to our youngest children, not only to help protect them, but to help to protect all of us as well. So please vaccinate your children. If you have questions or concerns, please talk with your child's healthcare provider about it. We're all here to help and to make sure that we keep everybody safe.
Thank you very much. And I'd like to especially thank our three panelists for tonight for sharing their information and their views. I hope this was helpful. Please, again, keep in mind that your best source of information is your child's physician or your physician. Our special thanks also to the Montgomery County Immunization Coalition and Beth Till for helping to set up these town halls, and also to Montgomery County and Kelly Cofrancisco for her technical expertise. So thank you all for joining us, and have a good night.
Bye. Good night.
Good night.